there is nothing on my sheets. There. Hello.
Hello.
My name is Riley. I'm going to be your student nurse from Saginaw Valley State University today, and I'm going to be performing your head to toe assessment. Can you tell me your name and date of birth?
Jude Maurer, June 30th, 2005.
Perfect. Wash your hands. Can you tell me where you are?
My room.
Why are you here?
For a checkup.
And what year is it?
2025.
And who's the president?
Trump.
Okay, so you're alert and oriented times 4. Do you have any allergies?
No.
Do you have any current or past medical diagnoses?
No.
Are you on any medications? This includes vitamins, herbal supplements, or over-the-counters?
No.
Okay, any family history I should be aware of?
No.
Any surgeries?
No.
Okay, and what's your diet look like?
2 meals a day.
2 meals a day? Okay. And vegetables, fruits included?
Yes.
Okay. And do you exercise?
Yes.
How many days a week?
4.
Okay. And is it more cardio or weight bearing?
Cardio.
Cardio? Okay. Do you drink alcohol?
No.
Okay. Do you smoke? This includes e-cigarettes, vaping?
No.
Okay. Do you do street drugs? Recreational drugs?
No.
No. Do you play any sports?
Soccer.
Okay. Do you have any pain when doing that?
No.
No. Okay. Have you broken any bones?
Yes.
What bone?
My left wrist.
Okay. And any pain with that still?
No.
Everything healed right?
Yes.
Awesome. Are you in any pain right now? In
No.
general? No pain? Okay. And anything else I should be aware of before I start your assessment?
No.
Okay, perfect. I'm going to start in on vitals. Relax. Using my diaphragm for blood pressure. Eat it together. Okay, 122 over 78. It's right in the range that we're looking for. 120 over 80. Awesome. Okay. Now I'm going to count your pulse on your radial for a minute, starting now. Pulse was 67. That's right in the range from 60 to 100 that we're looking for. Now I'm going to do this side. Another minute starting now. respirations were 18, which is right in between the range of 12 to 20 that we are looking for. Any questions?
No.
Okay. So now, by the thermometer, I take your temperature, but I don't. So are you feeling any fever or chills recently?
No.
Okay. Yeah. All right. You're not too warm or hot. So we're assuming you're at the 98.6 range. Can I see your hands? Okay. Capillary refills within 3 seconds. Color comes back. There's no clubbing of the fingers. And skin color looks good. There's no blue tint. So if I had a pulse ox, I would test for SpO2 and I would get around 95 to 100%. So now I'm going to inspect your arms. I see some redness and some moles. Any of that bother you?
No.
Any problem with that before?
No.
Okay. Now this side, no lesions, and then I see a tattoo. Has that given you any problems before?
No.
Okay. All right. I'm going to feel for muscle tone and lumps. There's no lumps, no muscle tone. Skin temperature is good. Muscle tone is symmetrical. And no discoloration, which is what we're looking for. Can you roll your wrist for me? Any pain with that?
No.
Okay. Can you push up on my hands? And down. And in. Or out. And in. Perfect. Can you squeeze my fingers? Awesome. Symmetrical strength. Can you flex and extend your biceps? Any pain with that?
No.
Alright. Can you push up and down and up? Perfect. And side to side head motion. Okay, that's your cranial nerve 11. Any pain with that?
No.
Okay. And do you know how to swim?
Yes.
Okay. Swim motion on this side. Any pain with that?
No.
No cracking on this side. Any pain?
No.
And minimal cracking. Is that normal?
Yes.
Okay. Perfect. I'm going to move on to your head now. Just going to inspect for any lesions, redness, or dryness. Do you dye your hair?
No.
Okay. Your hair is nice and healthy. No redness, no dryness, no lesions. I'm going to palpate now. Okay. Any pain?
No.
Okay. I'm going to feel your occipital note, lymph node. Any pain with that or tenderness? Perfect. Okay. Can you make a smiley face for me? And a frowny face. Mad face. Raise your eyebrows. And puff your cheeks. Okay? Go. Can you clench your jaw? And unclench. And clench. And unclench. Okay. I'm going to touch a spot on your face. While you close your eyes, tell me where it is.
Left cheek. Right cheek. Forehead. Nose. Chin.
Perfect. So that's your cranial nerves 5 and 7. No problem with those. Now I'm going to move on to your eyes. Do you wear contacts or glasses?
No.
Okay. Do you get any redness or itchiness in the eyes?
No.
And how often do you get your eyes checked?
Once a year.
Okay. So do you have any light sensitivity?
No.
All right. I'm going to conduct some pupil tests with my pen light. Just look straight ahead at me. I'm doing direct first. Pupil constricts. Direct again. Pupil constricts. Now I'm doing consensual. Pupil constricts. And consensual again. Pupil constricts. Straight ahead again. Pupils both constrict. Perfect. Now you do nose to pen light back with your finger. Awesome. Now look at my pen light. Look at my hand. Pen light. Hand. Perfect. Now follow my pen light with just your eyes. We're doing your cardinal gaze, 6 of them. Awesome. No problems with that. Now, can you make an okay sign with your hands and touch each finger to your thumb back and forth as fast as possible? Perfect. Now your hands on your thighs and flip them back and forth as fast as possible. Awesome. So that is your cranial nerves 3, 4, 6, 8. Your cranial nerve 2 is done with the Smelling chart, which I do not have. It's at your eye doctor. And your cranial 8 nerve is also at the end with your Romberg test at the end of the assessment. I'm going to move on to your nose. Do you have any random nosebleeds?
No.
Have you ever had surgery on your nose?
No.
Do you have any complications breathing?
No.
Okay, perfect. I'm going to look inside your nose, make a pig nose. Okay, your septum is not deviated, no polyps, and your mucous membrane is pink and moist, which is what we're looking for. Can you close one nostril and take a deep breath in and out for me? And out. Perfect. Any complications?
No.
Great. Other nostril. In and out. Any complications with that?
No.
Perfect. Can you close your eyes for me? I'm going to have you smell something. Tell me what you smell.
Coffee.
Perfect. That's your cranial nerve 1. And that is working good. I'm going to move on to your ears now. Well, before I get to your ears, do you have any sinus infections often?
Yes.
When?
Like twice a year with the weather changes.
Okay, and how do you heal those?
If it's too bad, I'll go to the doctor and get antibiotic.
Okay, I'm going to feel your frontal sinus and your maxillary sinus. Any problem with those? Any tenderness, pain? Perfect. Right, now onto your ears. How often do you get your hearing check?
Once a year.
Once a year. Do you have any hearing loss?
No.
Okay. And have you had tubes or currently have tubes?
No.
Okay. And do you use Q-tips?
Yes.
Where?
Like on the inside, but not. I don't go in.
You don't go in? Okay.
No.
Perfect. I'm gonna go ahead and take a look at those. Okay, just inspecting. No drainage. And no lesions, no redness. Other side. No drainage, no lesions, no redness. Okay, now I'm gonna palpate. Any pain or tenderness?
No.
Perfect. Now I'm going to move on to your mouth. Have you gotten your tonsils out before?
No.
Have you had braces?
Yes.
And how was that? Any pain?
No.
No complications anymore?
No.
Perfect. Have you had any teeth pulled?
No.
Any cavities? Okay. And any complications swallowing?
No.
Okay, no concerns?
No.
Okay, your lips look moist. Now if you can open up for me. Okay, your hard palate looks good, soft palate looks good, and your mucous membranes. Can you smile with your teeth for me? Okay, and your teeth look good as well. Can you wiggle your tongue outside of your mouth? Perfect. Okay, and can you say ah for me? Okay, pupil lobe rises on phonation. That's testing your cranial nerves 9, 10, and 12. Now I'm going to feel the rest of your lymph nodes. I'm going to do pre and postauricular, submandibular, submental, cervical chain, and supraclavicular. Any pain or tenderness with those?
No.
Perfect. I'm not feeling anything I shouldn't be. Now I'm going to move on to your neck. Have you had any thyroid issues?
No.
Okay, your thymus looks in line. Just a couple moles. Are those normal for you as well?
Yes.
Okay, perfect. I'm going to feel your carotid arteries. I'm using one hand at a time, and I'm using my bell to listen for any bruise. Start on your right side. Flipping it to bell. One hand. Okay, deep breath in. And out. Any pain with that?
No.
No bruise detected. Now moving on to your left side once again. Using my bell, only one hand. Okay. Deep breath in. And out. No bruise detected. Any pain there? Okay, perfect. I'm going to go ahead and check my sheet. Okay, I'm going to test for your tissue turgor on your clavicle. Okay, it returns, so your dehydration status is minimal. You're hydrated, which is good. That's what we're looking for. Gonna make sure radial arteries are symmetrical. So are your brachial. Perfect. Your neck, no respiratory excessive use of your accessory muscles, which is what we're looking for. It's all good. Skin color looks good, and so does your temp. So I'm gonna have you turn around for me. Perfect, thank you. Okay. I see some moles. Are those normal for you?
Yeah.
Perfect. And your spine is symmetrical in spot. And I'm going to place my hands around your neck. I am not choking you. I'm going to find the notch in your thyroid. Place it to the side. Not palpable. Any pain with that one? Okay, now to your right side. Not palpable. Any pain with that as well?
No.
Perfect. Okay, now I'm going to move down to the bottom of your lungs around T10. Can you take a deep breath for me? And out. Perfect. That's the base of your lungs. Now I'm going to listen 12 times using my diaphragm for your lungs to make sure there is no wheezes or crackles. At 6, I'm going to ask if you need a break and raise your hand if you need a break beforehand, okay?
Okay.
Switching it to diaphragm. Perfect. All right, good. Oh, perfect. 1, 2, 3, 4, 5. Okay, that is 6. Do you need a break?
No.
Okay. 7, 8, 9, 10, 11, and 12. Perfect. Lung sounds are clear. Now I'm going to percuss in that same area. We are looking for resonance. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Perfect. I'm going to have you go ahead and lay down for me. And I'm going to move my camera. I'm going to move this down as much as I can keep your privacy still. Perfect. Can you hold the camera for me? Got it. Okay. I'm going to move your pillow for a second. Awesome. Can you lay your head to the left and to the right? Okay, no jugular vein distension is detected. Have your pillow back. Okay, now inspecting your stomach. I'm seeing some red marks. Are those from sports?
Yes.
Okay, and how are those healing?
Good.
Any pain?
No.
Okay, awesome. So now I'm gonna listen to your heart sounds. I'm gonna start on your right side and listen to your aortic. I'm gonna listen to with my diaphragm for S1, S2, lub dub, and then flip it to my bell to listen for any heart murmurs. Then I'm gonna switch to the left side. I'm gonna do the same for my pulmonic, my Erb's point, which is the loudest point, the tricuspid, and the mitral, which is where I'm gonna take your apical pulse. I'm on my diaphragm, right clavicle. Okay, rib 1, intercostal space 1, rib 2, intercostal space 2. The diaphragm. S1, S2, lub dub, flipping to my bell. No heart murmurs detected. Back to my diaphragm. Now on the left side for my pulmonic. Clavicle. Rib 1, intercostal space 1, rib 2, and intercostal space 2. Diaphragm. S1, S2, lub dub, flipping to my bell. No murmurs detected. Now going down to Erb's point. Rib 3, intercostal space 3, diaphragm. S1, S2, lub dub, flipping to my bell. No murmurs detected. Back to my diaphragm. Rib 4, intercostal space 4. And this is my tricuspid. Okay. S1, S2, lub dub, flipping over to my bell. No murmurs detected. Okay. Head down to rib 5, intercostal space 5, over to the mitral valve, with my diaphragm. Gonna listen to the apical pulse for a minute. Starting now. Awesome. 70. Now I'm flipping over to my bell to listen for murmurs. No murmurs detected. Perfect. So now I'm going to move on to the abdomen. Position my camera. I'm going to look at the end of the bed, and I'm looking for any masses, lumps, irregular breathing. Everything looks symmetrical. I'm moving my camera again, and I'm going to assess bowel movements. Okay, I'm using my diaphragm. I'm listening to 3 to 5 gurgles. Diaphragm's on, starting in the right lower quadrant. 3 to 5 gurgles detected, right upper. 3 to 5 gurgles detected, left upper. 3 to 5 gurgles detected, and left lower. 3 to 5 gurgles detected. Now I'm moving to my bell, and I'm listening to the arteries for any bruise. Starting at the aortic artery that's between the umbilical and the xiphoid process, right about here. No bruise detected. Now I'm moving to right renal. No bruise detected. Left renal. No bruise detected. Left iliac. No bruise detected. And right iliac. No bruise detected. So now I am going to percuss around the stomach, and we're listening for tympany. Okay, tympany is heard. Now I'm going to find where your liver border begins, also percussing. Okay, and that's where your liver border is because the sound went from tympany to dull. Now I'm going to palpate. I'm going to do light and then deep. Let me know if there's any pain. I'm feeling for any masses. Any pain with that?
No.
Okay, I'm gonna go deeper. Any pain with that?
No.
Okay, there was no pain with that. We're gonna move this back here. Okay, go ahead and put this back on. Continue to lay down though. I'm gonna move this up toward your legs. Okay, looking at your legs, I see some scars and moles. Have you had any problems with those?
No.
Are those regular for you?
Yes.
Okay. I'm going to feel anything. No lumps or masses. masses. Any pain with any of that?
No.
Okay, testing for edema. No edema is present. Looking at the toes, I see some dryness. Is that just from the weather?
Yeah.
Okay, checking your capillary refill. Comes back within 3 seconds, which is perfect. Now I'm going to feel for your femoral artery. Reposition the camera. Okay, you have to hold it.
Sorry.
There's good, yeah. Okay, I'm using that. Okay, femoral artery detected. Femoral artery is strong and symmetrical on each side. Now I'm going to use my diaphragm. And I'm going to place it to listen for any bruise. Okay, my stethoscope's right here. No bruise are detected. This back. Repositioning my camera. Okay. Now I'm feeling for popliteal pulse. Pulse is strong and symmetrical. Okay. Let me hold it just like that. Okay. Posterior tibial. Pulse is strong and symmetrical. And no doralis pedis. Pulse is strong and symmetrical. Thank you. Checking my sheet again. Okay. Now, I'm going to do a sharp and dull sensation on you. If you close your eyes, tell me if it's sharp or dull and where it's located.
What's sharp and what's dull?
This will be sharp and this will be dull.
Okay. Sharp left thigh. Sharp right thigh. Dull left shin. Sharp left or right shin.
Okay.
Dull left foot. Dull right foot. Dull right sole. Dull left sole.
Perfect. So you are 8 for 8, so I'm not concerned about any of your nerves in your legs, and your temperature feels good as well. So I'm going to have you go ahead and sit up for me. Okay, I'm going to check your capillary refill one more time just to make sure. It comes back within 3 seconds. Can you rotate your ankles for me? Any pain with that?
No.
Okay, can you push up? And down. And out. And in. Perfect. Can you push up on this side? And this side. Awesome. So your range of motion is good in your legs. No concerns there. Okay. Perfect. Your patellar reflex is good as well. That's what we're looking for. You can go ahead and put your socks back on for me. Don't stand up yet. Have you fallen recently?
No.
Have you had a history of falls?
No.
No? Okay, perfect. Do you ever feel dizzy or uneven?
No.
Okay. Awesome. Put your shoes on as well. Don't stand up yet. Don't stand up yet.
Sorry.
Perfect. Stay seated. Okay, go ahead and stand up for me. Okay, how do you feel? Do you feel like you're gonna fall or uneven?
No.
Okay, can you keep your legs shoulder length apart for me? Arms a little bit from your body and close your eyes. Stand straight. Okay, minimal swing, so I feel safe to continue to have him to walk. Can you turn for me this way and take a couple steps to normal walking for me? Just normal walking. Awesome. Now turn and normal walk back. Feel okay?
Yeah.
Now turn and walk heel to toe. And turn back. And heel to toe. Perfect. You can go ahead and have a seat for me. Okay, how do you feel? Good?
Good.
Okay, so on the brain scale, I give you a 23. I don't have any concerns because you have a good diet, good exercise, your sensory is good, no concerns with your neuro, and 23 is the highest score you can get, so I have no concerns.